What is thorax? Thorax is a word which is derived from a Greek word which is thora, which means chest or thorax or breastplate. Okay, if you see in this diagram, you have to see the cursor, the moving cursor, which I am moving over the diagram. So see this diagram. Okay, this is the diagram of the thoracic cage. Okay, can you see the thoracic cage? It is flattened from anterior side as well as it is flattened from the posterior side also, but it is circular on each side, that is, it is circular laterally. Okay, if you imagine from your own body, you can see that it is covered by skin and muscles from the exterior. That is, the skin and muscles will cover it exteriorly, and there will be parietal pleura interiorly. Parietal pleura is a layer which is covering the lungs. Okay, so skin and muscles are covering it exteriorly, and parietal pleura will be covering or will be present on the inner side. Okay, this thoracic cage, if you see the formation of thoracic cage, it is formed anteriorly by a bone. Can you see this bone here? This is called as sternum. Okay, which we have shown it in a separate diagram also. This is sternum. So thoracic cage is formed anteriorly by the sternum. Posteriorly, there will be many vertebra, which are 12 thoracic vertebra. Okay, we do have 33 total vertebra in our body, which forms vertebral column. Out of those 33 vertebra, the 12 thoracic vertebra will be present posterior to the thoracic cage. Okay, and on each side we have 12 ribs. Okay, these are 12 pairs of ribs, that is the 12 ribs on the right side and 12 ribs on the left side in each male or female body. Okay, so what is the formation of thoracic cage? Thoracic cage is formed anteriorly by the sternum, posteriorly by the thoracic vertebra, and on each side by the 12 pairs of ribs. Okay, if you see that the thorax, this is covering the main vital organs, which are heart and lungs. Okay, the thorax, it is communicated with the neck. We have a neck here. Okay, so it is communicated to the neck, and it is separated from the superiorly it is communicated with the neck, and inferiorly it is communicated, or you can say it is separated from the abdomen by a diaphragm. There will be a dome shaped diaphragm inferiorly. Okay, so you have what you have learned. You have learned the formation of thoracic cage. It is formed by three structures: anteriorly by the sternum, posteriorly by the thoracic vertebra, and laterally by the ribs. Okay, and it is connected superiorly by the neck, and it is separated inferiorly from the abdomen by the diaphragm, the dome shaped diaphragm. Okay, as I have already told you that this thoracic cage is supporting, or it is protecting, the lungs and heart. Now the thorax or the thoracic cage can be divided into three parts. One median part, that is called as mediastinum. Okay, the mediastinum is the area of the thoracic cage in which the heart and great vessels are present, and two lateral areas on each side of the mediastinum. These areas will be called as pleural spaces or pleural cavities, because in the pleural space lungs will be present. Okay, the lungs will be covered by two pleura. One is called as parietal pleura, and the another one is called as visceral pleura. Parietal pleura will be present on the inside of the ribs, and visceral pleura is covering the lungs, and the space which is in between the two pleura is called as pleural space or the pleural cavity. I hope that you have understood. Again, I will repeat, this thoracic cage is divided into one median portion. That median portion will be called as mediastinum, and two lateral spaces which are called as pleural spaces or pleural cavities. Okay, now This was only the review or the introduction of the thoracic cage. Now I hope that you understood that which region is thorax region. It is derived from a word, Greek word thora, which means breastplate or chest or thorax. Okay, it is the area which is covering or which is protecting the lungs and heart. Okay, now we today in this lecture we will do the osteology. Okay, we will cover the osteology part. Number one, the formation of thoracic cage. Number one is sternum. Okay, can you see this bone, sternum? Okay, sternum. This is also sternum, comes from a Greek word stern. Stern means breast or breastbone. Okay, this sternum has three parts. Can you see? This is the upper part, then there is the middle part, and then there is the lower part. The upper part is called as manubrium. Then the middle part is called as body or blade, and the lower part, this is called as Zephoid process. Zephoid process. Okay, this is Zephoid process. Okay, now manubrium, the word manubrium, the Zephoid process is also called as Zephisternum. Okay, can, if you see this bone very carefully, this is just like a sword. Okay, this is just like a sword. Okay, because sternum also means stern comes from the breast or the breastbone, but this bone looks like a sword. And this manubrium means, which comes from a Latin word manubrae, okay, which means handle. So this is the handle of the sword. Okay, this body, this is the blade of the sword, and this Zephisternum, this is the tip or the pointed process of the sword. This is the pointed process of the sword. This sternum is about 17 centimeter long. It is more long in males and it is short in females. Okay, now we will do the sternum with separate parts. Number one is manubrium. I have told that manubrium comes from a Latin word manubrae, okay, which means handle. This is the thickest part, the strongest part. If you see manubrium very carefully, you can see that it has two surfaces. This surface, which is shown in the diagram, this is outer surface, and there will be inner surface on the inner side, and there are four borders. Can you see four borders of the manubrium? This is upper border, this is lower border, and there are two lateral borders. One is right lateral border and one is left lateral border. This is left lateral border, this is right lateral, and this is left lateral border. If you see the superior or the upper border, there is a notch here. Can you see the notch? This notch is called as suprasternal notch because it is over the sternum. So it is supra means above, sternal notch, or it is also called as jugular notch, or it is also called as interclavicular notch. There are three names for this notch: suprasternal notch, interclavicular notch, or jugular notch. Okay, why interclavicular? Because it is in between the two facets of the clavicle. These are the facets of the clavicle which are called as clavicular notches. So it is in between two clavicular notches, so it is called as interclavicular notch. Okay, and on the lower border, can you see this ridge, a transverse ridge? This is called as sternal angle, or the angle of Lewis, which is very important landmark in anatomy. It will show many important points which you have to remember. This is called as sternal angle, or this is angle of Lewis. Okay, now I will tell you two levels here which are very important and which will come in the MCQs. Okay, this manubrium lies opposite the level of T3 and T4 vertebra, that is third thoracic vertebra and fourth thoracic vertebra. The sternal angle lies posteriorly. It lies opposite to the intervertebral disc between T4 and T5. Okay, you have to remember manubrium lies opposite T3 and T4. Sternal angle lies opposite T4 and T5. If an exam comes that the sternal angle lies opposite the vertebra, for example, if the options are T3, T4, T5 and T6, then you have to mark T4. Okay, then you have to mark T4. This sternal angle is showing a joint. Can you see the joint here? This is manubrium and this is the body of the sternum. So this joint will be called as manubrosternal joint. This is called as manubrosternal joint. This manubrosternal joint is actually the secondary cartilaginous joint. Okay, this is secondary cartilaginous joint. I will tell you one thing, that in thorax, the joints of thorax are very important. In exam, the joints will come in MCQ as well as in SCQ, and they are usually asked in your viva also. The names of the joints of the thorax and the types of the joints of the thorax. So after every bone, I will tell you a summary of the joints made by that bone. Okay, for example, here I will tell you the joints which are formed by the manubrium. Number 1, what is the joint? See here, can you see this facet for the clavicle? Here clavicle will attach, so it will make a joint which is called as sternoclavicular joint. Okay, sternoclavicular joint. Then which joint? Manubrosternal joint. The sternoclavicular joint is of saddle synovial variety. Saddle synovial variety. And the manubrosternal joint is secondary cartilaginous joint. Now, can you see on the lateral borders, there are two facets for the first costal cartilage. This is for left side and this one is for right side. Again, I will show you. See here, see the cursor which I am moving over the diagram. This is right facet for the first costal cartilage and this is left facet for the first costal cartilage. They will also form one joint which is called as chondrosternal joint. This is chondro. Chondro is a word which is used for cartilage and this is sternum. So this is first chondrosternal joint. This joint is of primary cartilaginous type. This is of primary cartilaginous type. So three joints are made by the manubrium. Okay, number 1 is sternoclavicular joint, which is saddle synovial variety. Then first chondrosternal joint, which is primary cartilaginous joint. Then manubrosternal joint, which is secondary cartilaginous joint. Okay, secondary cartilaginous joint. If you see very carefully the lower part of the lateral border of the manubrium, it has a facet which is for the upper part of the second costal cartilage. So we will say that only on the manubrium there is a demi-facet. Why it is called a demi-facet? Because the half of the facet will go over the body of the sternum and it is covering or it is articulating the half of the rib. That is a demi-facet word will be used. So manubrium will also give attachment to the upper part of the second costal cartilage also. Now, if we go for relations, the anterior surface of the manubrium, it is related with two muscles. Two muscles are attached anteriorly. Number 1 is pectoralis major muscle and number 2 is sternocleidomastoid muscle. Okay, this can come in your MCQ. What are the two muscles which are attached to the anterior surface of the manubrium sterni? One is pectoralis major muscle and one is sternocleidomastoid muscle. Posteriorly, if we see the relations of the manubrium, there are again two muscles. One is sternohyoid and one is sternothyroid, and posterior surface of the manubrium is related with many veins and arteries. What are the veins? They are left brachiocephalic vein, there is brachiocephalic artery, there is left common carotid artery, there is left subclavian artery, and there is arch of aorta, which are related posteriorly with the manubrium sterni. And laterally, if you imagine what is the structure which is present laterally, these are lungs and which are covered by pleura. So lungs and pleura are present laterally on right side as well as on the left side also. Okay, this was manubrium. This was the first bone. This was the first part of the sternum. I will repeat again. This is the thickest bone. This is the strongest bone of the sternum. This is the handle of the sword because this is just like a sword. So this is handle because manubri means handle. Okay, this is a Latin word, manubri. This is upper border. This is lower border, and these are two lateral borders. Upper border will have a suprasternal notch, which is called as jugular notch. notch, and there are two facets for the clavicle here, which will form the sternoclavicular joint. Then on the lower border, this is manubrosternal joint, which is secondary cartilaginous. Then on each side, there are two facets for the first costal cartilage, which will form first chondrosternal joint, which is of primary cartilaginous variety. Now I will tell you 4 points of importance, which is the important landmark, which is the sternal angle. What are the 4 points which you have to remember? Because this is the most important question which is asked in exam for this lecture, that what is the importance of sternal angle, or what is the importance of this angle of Lewis. Okay, number 1 importance, it is forming the manubrosternal joint. Number 2, it is at the level of second costal cartilage. Number 3, posteriorly, it is at the level of T4 intervertebral disc. And another point, that this is the line which is separating the superior part of the mediastinum to the inferior part of the mediastinum, because mediastinum is the area which is present behind the sternum, in which heart is present. So this is the line which is demarcating, or which is telling us that above it will be superior mediastinum and below it will be inferior mediastinum. I hope that you have understood the importance of sternal angle. Now, can you see, we will come towards the body of the sternum. This is the body. This body is usually having 4 parts in neonatal life. Okay, before ossification, it will have 4 parts. Those 4 parts are called as sternebrae. 4 sternebrae are present. So actually the whole of the sternum has 6 parts in the neonatal life. What are those 6 parts? Number 1 is manubrium. Number 2, 3, 4 and 5 are the parts which are said sternebrae of the body of the sternum. And 6th part is Zephysternum, or the Zephoid process. They will join together and they will form a single bone which is called as sternum. Okay, here the body of the sternum, it is attached, or it will give articulation to the lower part of the second costal cartilage, third costal cartilage, fourth, fifth, 6th and 7th costal cartilages. They are forming chondrosternal joints. Second chondrosternal, this was first chondrosternal which was formed by the manubrium, and this is second chondrosternal, third, fourth, fifth, 6th and 7th chondrosternal joint. These are synovial joints. These are synovial joints. Okay, so this was about the body of the sternum. Here also the upper part of the body of the sternum is covered anteriorly by the pectoralis major muscle. By the pectoralis major muscle. Now we will come towards the Zephoid process. Zephy word also comes from a Greek word which means which is Zephy, which means sword, or the point of the sword. Okay, Zephy actually means sword, or the point of the sword. So the Zephoid process is forming a joint with the body of the sternum. If you see in the diagram, this line is showing a joint which is called as Zephysternal joint. This Zephysternal joint is of primary cartilaginous variety. Primary cartilaginous variety. Okay, I am repeating the things again and again so you can remember all these things very carefully or by heart. Okay, this Zephoid process does not give attachment to any of the rib or any of the costal cartilage, but it will give the pointed part, or the lower part of the Zephoid process will give attachment to the linea alba. Linea alba is a line in the abdomen which is in the median plane. Okay, which is called as linea alba. Okay, linea alba. Okay, so this will give attachment to the linea alba. Number 2, it will not give any attachment to the rib or the costal cartilage. Okay, so this is Zephoid process. There is another important thing which you have to learn. What is that? That the Zephoid process lies at the level of T9. This can also come in the exam. That is what is the level of the Zephoid process? It lies at the level of T9. That is 9th thoracic vertebra. 9th thoracic vertebra. Okay, so this was the first part of the osteology. We have covered the sternum. Okay, here I have pasted the video links, which I will paste over the along with the lectures also. Okay, please see these video links. Actually, why I have pasted the video links here, because this is the practical session, the dissection part, which is the first lecture of the dissection, in which you have to hold the bones in your hand and you have to see the bones. Okay, so please see these videos. Inshallah, everything will be very, very clear to you. Okay, I hope that you will see all these videos. I will show, because I have pasted, because there are three parts of osteology. Number one is sternum, number two is rib part, and number three is vertebra part. I will show you one of the videos out of three. Okay, so this was, we have covered the sternum. I hope that you have remembered the sternum and the joints which are formed by the sternum. Okay, I will revise or give you a summary with the joints of the sternum. If you have, you should have pencil and copy in your hand when you are seeing my lecture. Okay, so you can write the important points of MCQ, SCQ, as well as Viva. Okay, so I have told you four joints. Number one is sternoclavicular joint, which is of saddle synovial type. Number two is manubrosternal, which is secondary cartilaginous. Number three is chondrosternal. In chondrosternal, we have first chondrosternal, okay, which is primary cartilaginous. Sorry, and we have second to seventh chondrosternal, which are synovial joints, and we have the last one, which is zephisternal joint, which is primary cartilaginous joint. I will tell you one point about the clinical part of the sternum. Okay, there is one thing which is one term which is called as sternal puncture. You know that the sternum is a bone, okay, cancellous bone, which is lined by the compact bone, and it has red hematopoietic bone marrow for the whole life. So if somebody has to do the bone marrow biopsy, what they will do, they will do the sternal puncture. A wide bore needle will be used, okay, and marrow or bone marrow will be aspirated, okay, for the biopsy. This is called as sternal puncture. This is first importance. And number two, a sternum can be split, okay, if the surgeon has to do the thoracic surgery. If he has to gain access to heart or lungs, he can split the sternum into two parts and he can gain access to heart or lungs to do the surgery. Okay, so this is also very, very important thing. Okay, this is the video link which I will paste along with the lecture also. See here, can you see this diagram? This diagram is also very, very important. It is the side view. It is showing some of the levels. Can you see here? This is manubrium. This is the body of the sternum, and this is Zephoid process. This is the area of the median part, which is called as mediastinum. Okay, and these are posteriorly, these are the thoracic vertebra, from first thoracic vertebra till 12th thoracic vertebra. So suprasternal notch lies at the lower border of T2, or it is in between T2 and T3. The bone manubrium lies opposite T3 and T4. Sternal angle lies opposite the intervertebral disc between T4 and T5, and the Zephoid process lies opposite the vertebral level T9. These are four levels which you have to learn here. Okay, so from this diagram you can learn these levels very carefully.